Hi, my name's Steve Bowens. I am at Portreath Surf Lifesaving Club. I'm a lifeguard trainer assessor and the founder of the Surfers Helping Surfers project. We're here because there's been a number of incidents on the local beaches, and I want to talk through what you can do if you come across somebody on the water's edge or on the beach and they don't appear to be breathing normally. So we're going to take a really simple approach to help us remember what to do if we're going to assess a casualty. And it's called Dr. ABC. Dr. ABC stands for danger, response, have they got an airway, are they breathing, and are there signs of circulation? I'm now going to demonstrate the Dr. ABC approach. The first thing we need to do is to check for danger, to make sure there's no danger to me approaching the casualty, to make sure there's no danger to people immediately surrounding them, or indeed any danger to the casualty themselves. Remember that we're on the water's edge, and so probably the most obvious danger is going to be an incoming tide or any big surges from the waves. After we've checked for any dangers, we're going to check for a response. If they don't appear to be awake, I'm just going to speak to them and introduce myself. "You all right, mate? I'm Steve. Can I help you?" If they don't seem to be responding to my voice, I might need to get a bit closer to them. Because of the current COVID situation, if we've got it available, we need to make sure we put a mask on and put our gloves on. Because they don't seem to be awake and they're not responding to my voice, I'm going to have to get a little bit closer. So if it's available, I put on a mask and I put on some gloves. So I'm going to use a physical stimulus now. I'm just going to tap them on the leg with my foot. But if I need to get closer to them, I need to cover their mouth and nose just to reduce any expired air coming from the casualty. The only thing I've got lying around is a towel, so I'm just going to gently place that over their mouth and nose. I'm not going to tap them on the shoulders. "Hello, can you hear me? Open your eyes." Now we've checked for danger and response, we're now going to do the ABC. Check their airway, check for normal breathing and signs of circulation. To check the airway, we're going to do what's called the head tilt chin lift. That's simply lifting the chin up towards the sky and holding them in this position. That can be enough for some people to start breathing normally again. We're then going to check for breathing. We're looking for normal breathing, the chest rising and falling. If they've got a wetsuit on, that should be fairly easy to see. If they've got a big outdoor jacket on, we might need to unzip it to see if the chest is rising and falling normally. And if they're gasping or gurgling, remember that's not normal breathing. The last thing we want to do is just check for signs of circulation. The colour of their skin shouldn't be blue or really pale, and notice if there's any significant or catastrophic bleeding. So it's clear that this guy needs some help, and I know now that he's not breathing. If I've got somebody with me or there's somebody stood here, I'm going to send them to go and call for an ambulance, or if we're in a more remote location, which a lot of surf spots are, I'll ask them to get the Coast Guard if the ambulance can't get directly to us. I'm also going to ask them to go and get an AED or a defibrillator if there's one readily available. If I'm on my own, I'm going to call 999 on my mobile phone and I'm going to put it onto speakerphone. That way I can set it in the sand next to me and the operator can help me through the next stage. As soon as I know somebody's gone to get help and the ambulance is on its way, I'm going to start doing CPR. Because of the COVID situation, I'm not going to do mouth to mouth on this casualty. I don't know who they are. But what I can do is I can do compressions only CPR, which is very simple to do. I'm just going to interlock my fingers, one over the other, use this part of my hand in the middle of the chest, my shoulders above my wrists, and I'm going to press hard and fast. I'm going to compress about 100 to 120 compressions a minute. I'm going to go to a depth of about 6 to 8 centimeters. If you've got a helper who's gone to get an AED or a defibrillator, as soon as they arrive back, you need to turn it on and follow the instructions. AEDs are very simple to use. Anybody can use them, and they're completely foolproof. Even if you press the button to shock somebody and they don't need a shock, it will not shock them. When you open the AED app, they come with some standard equipment. There'll be a pair of tough cut scissors which you can use to remove clothing from the casualty's chest. There'll also be a resuscitation mask, some gloves, And there'll also be a razor. If the casualty's got a really hairy chest, you may need to remove the hair where the pad is going to go, so the pad is in contact with the skin. An AED works by sending a shock from one pad to another pad through the heart. And that means that the pads must be in contact with the casualty's skin. They've got a diagram on them to show you clearly where they need to go. So now I'm going to turn the AED on and follow the instructions. It's going to ask me to remove the clothing from the casualty. This casualty is wearing a wetsuit, so I'm going to use the tough cut scissors to remove that. I'm going to cut it all the way down to the belly button, and any clothing on underneath that, we're going to remove that as well. Remember, if they've been in the water, they might be wet as well, so if we've got a towel, we can just dry off the areas where the pad's going to go.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Open packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures. Open packet and apply the pads as shown in the pictures. Press pads firmly. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
Going to check the head, waist, feet. Everybody stand clear. Press the button.
Shock delivered. Begin CPR.
Once we have the AED on the casualty and we're doing CPR, we're doing everything we can for them. So we're just going to keep going. We're going to keep going until a paramedic tells us to stop, or there's obvious signs of life from the casualty, or if we get too tired, we can swap around with somebody who's also been helping us. So if you come across somebody in the water's edge and they clearly need help, there's some really simple steps that you can take. 1, check for danger. Make sure it's safe before you approach them. 2, see if they're responsive. 3, check their airway, breathing, and signs of circulation. Call for help by dialing 999 or 112 and ask for an ambulance, or in a more remote location, ask for the Coast Guard. Tell them where you are, what the problem is, and the number of people. Thank you so much for watching this short video. The simple information in this might be enough to save somebody's life. I'm Steve from H2O Training. If you'd like to find out any more information about first aid courses or lifeguarding courses, just drop us an email at info@h2otraining.co.uk. Thanks very much.